Oh yeah, that's my job.
I'm Justin. I'm Griffin.
Alex.
I'm Joel.
Audrey.
Hello, my name is Jessica Doherty, and today I will explain to you all about my career path as a cardiothoracic surgeon. My grandfather once told me there are two kinds of people in this world. The first group, they do the work. The second group, they take the credit. My grandfather told me to be a part of the first group. Why? Because it's much less competitive. Alright, today we'll be talking to you about how my personality connects with my career and how I like to help people. Then I will talk to you about cardiothoracic and what it entails as far as the job outlook and the requirements. And then I will talk to you about again the requirements in more detail as far as how long and how much it's going to cost. All right, personality versus career. First, we're going to talk about how my personality connects to different jobs. With the previous assignment that we did, I learned that I was a ENFJ, extrovert, intuitive, feeling, and judging. And with that combination, I learned that I was more prone to pharmacists and optometrists. As you can see, it's already in the medical field, so I'm heading in the right direction. Like I've said, I always love helping others, and as far as helping, comes with teaching. Some of the best people, they teach in order to help, and I find that really, really inspiring. And last, as a cardiothoracic surgeon, some of the things that I will be doing is examining patients, interpreting diagnostic tests, counseling patients on preventative health care, because if you can prevent something, then you don't even need to see me, and that's the greatest gift of all, because if you see me at that point, you're already sick, and then I feel sad. That's where my feelings come in with the F in my personality. And then last but not least, perform surgery, because what's a surgeon without surgery, right? All right. According to the Occupational Outlook Handbook, the cardiothoracics are growing at a rapid pace of 18%, which is much faster than the average profession. And according to the Comprehensive Guide for Careers, cardiothoracic surgeons work in hospital surgical wards, and that is pretty much the main place that they operate in, because you can't really operate in a patient room or the lobby. It's not too appropriate. All right, requirements. They're organized into 3 different categories: bachelor's, typical 4 years; medical school, about 4 years; and then there's clinical training. And those are divided into 2 sections. There's the residency, which takes up to 5 years, and then the fellowship takes anywhere up to 1 to 3 years, and that's according to the educational portal. All right, the hustle. How do we get to where I want to be? I'll tell you. First, I'm going to get my bachelor's. Again, we're all here pretty much for our associates, I'm assuming, for 2 years. And then next, I will go on to UCF and to direct connect for my remaining 2 years. As far as the cost, because you can't just walk up and be like, give me my degree. You're not going to do it that way. You got to fortunately buy your degree in a sense. As far as Valencia, entering my last semester coming up in this summer, I will be spending about $8,000. And as far as UCF, for the remaining 2 years, it's going to be about a total of $12,700, which it breaks down to about $6,350 each year, according to the UCF catalog tuition of 2014-2015. And to wrap it up, I talked to you about how my personality, works with my career as far as helping others. I talked to you about, what it takes to be a cardiothoracic, where they work, the duties they perform, and I talked to you about the requirements of achieving to be a cardiothoracic surgeon, because, what's a course of action, without steps. According to Brainy Quotes, John F. Kennedy former president, said something really inspiring. He said, things don't just happen. Things are made to happen. And with that, I'd like to conclude my presentation.